Andrew Weil gave me this walking stick when I graduated from the Arizona Center for Integrative Medicine. I planned to use it on one of my big hikes to the national park, but it's too long to put in a airplane, and plus I don't want to mess around with it, so I use it as a decorative piece in my house. Anyway, arthritis is the topic I'm talking about now. SAMe in particular for arthritis. SAMe is S-adenosylmethionine. I've been recommending it frequently in the last couple weeks since I started my new job in Bartlett. I've been seeing quite a bit of people over 60 with some form of arthritis, or knee pain, or decreased range of motion because of some flare-up because of the weather, or in fact for some depressive symptoms because of seasonal affective disorder really taking its toll on some of my patients who were previously stable. So yes, SAMe does work for both. Works as a neurotransmitter, also works to kind of lay down the matrix in an already arthritic knee. And again, it's been studied for almost more than 15 years. There are studies that, well, if you go to consumerlab.com, I believe without having a prescription or a subscription to it, you can get the list of studies that have been quoted and the ones that I follow. And they're not just case studies, they're full head-to-head studies. So it's worth it to at least check out the website, consumerlab.com. But for the purposes of joint pain and some depression, I like SAMe. SAMe is actually, I think, a little stimulating. I tried it. I always try most of the supplements I suggest to my patients, and I don't have arthritis. At least I didn't think I had arthritis. I might have a touch of seasonal affective disorder, but it didn't give me any side effects, and it actually helped an old shoulder issue improve. I had better range of motion in my yoga practice. That too, in addition to whether it's placebo or not, a better outlook on the winter. And I also have a new job, so who knows. Anyway, it did not cause any bad side effects with me at maximum dose. So what I suggest for most people is to get the individually wrapped blister packs. And it's because SAMe has this, it's very sensitive to heat and moisture. Some companies will say that they enteric coat and put in a brown bottle. I don't trust that. I really think that if you're going to be trusting your medical disease, which would either be some form of depression or some form of arthritis, if you're going to be trusting it for the length of time that SAMe takes to work, which is maybe up to 3 months, sometimes really quick. SAMe's pretty quick with regards to depression. Knee pain, it can take a while. But if you're going to be waiting a season, potentially a season or up to 6 months, you want to be loading up on something that has been tested already. The brand I get, Yarrow brand, happened to be approved by consumerlabs.com, but there were several others, and they had a long list of the ones that they tested and had individually certified. But you can see who tested and how it tested out. But with regards to the use of SAMe, it's usually a twice-a-day dose. You can't take the evening dose too late at night because it is a little stimulating, which is good for depression, but it's going to screw up your sleep. I think twice-a-day dosing is important. I think the individually wrapped in blister packs is very important. You will have to pay a little more, so that's the only problem with SAMe is the amount. But again, if you go to consumerlabs.com, you can see that of all the tested brands, you can see the cheapest one that you might be able to afford. It might not be blister packed, but I guess as long as it's enteric coated, it should be okay. It's worth the try. You have to try something within your means. But if I made the specific suggestion to you for trying SAMe in this next 3 months until we meet again, then see what you can afford, but don't go too cheap. Because the next step is either I give you a prescription painkiller, anti-inflammatory, antidepressant, or you get a referral. So maintain, always maintain a mostly whole food, plant-based diet with a little bit of meat And for those of you who can't get away from meat, just try to maintain a fish Friday and a meatless Monday at least. That's 2 days of the week that you won't have anything. And a lot of fluids, a lot of fiber, and I'll put a link to my fiber lecture. And I think that will help with the depressive illness, that will help with the arthritic illness, and then get out there and move. If you can't get out there and move because you're a 50 to 60 hour week worker, then try some form of meditation practice or spiritual practice, because even if you can't get out and do a 10-minute walk, actually 10 to 20-minute walk up and back, which really doesn't take much time as long as you're suited for it, then at least you can afford a 5 to 10-minute sit in your room, quiet breath exercise, which is very powerful. I don't mean to say that, I don't mean to downplay that, but you have to have some form of thinking change, which is meditation or relaxation practice. You have to have some form of movement change, which is activity. You have to have some form of nutritional change. And I think if you manifest all three at the same time, it'd be best, but you have to, again, pick and choose your fights depending on your lifestyle now. But if you only pick two, then hopefully you get healthy enough and you feel the benefits that the third one will come sooner or later. And that might come in a change of job, or some other opportunity that opens up, but you won't be able to get there if you don't make any changes at all. Sometimes SAMe will work, sometimes glucosamine sulfate will work, but I think in the process of taking care of emotional instability and joint pain, SAMe is number one.